I met Dr. David through a local networking group looking for a new physician, naturopathic doctor, and so we hit it off right away and started to come see him for just general care. The types of services and treatments that I've had using naturopathic doctors is, well, treating colds, flus, sinus infections, any other type of pain or ailment that I've had. I've found the solutions through naturopathic medicine to be much better, healthier for me, and I've responded better than other, traditional forms. So I really enjoy my relationship with Dr. Gallegos because, one, he is very informed, and he's very good at explaining everything about how he goes about treating patients with different issues, and it's him being able to explain it in a way that I can understand it, that makes sense to me, that has earned my trust. And he is very thorough in everything he does, and he ensures that I have complete understanding every step of the way of what he's recommending as a treatment plan and why it's going to be beneficial for my body. And my relationship with him has been fantastic. Today, I'm here for a PRP and A2M injection in my lower back because I have some arthritis and some bulging discs in my lower back. And this method is supposed to bring healing and speed up recovery because it's taking basically the plasma that's already in my blood, spinning it and re-injecting it back into the area that needs treatment, speeding up the healing process. And with that A2M injection, that's a alpha-2 macroglobulin protein. Well, it's a molecule that's already in the bloodstream that they take out and they can put it back in, that also helps speed up healing and addresses degenerative issues within your body. The reason I like naturopathic medicine so much is because it helps me and my body do what it naturally does and helps it heal itself. All right, so here we are at the end, or I should say the beginning. Procedure is about to take place, going to get prepped. I'm really excited because I've been dealing with this situation for going on almost a year now. And so I'm ready to get that healing going because I have more rim to rims to do. So I'll see you on the other side.
All right, so today we're going to do a PRP with an A2M regenerative injection on a lumbar spine. And we're also going to hit the SI joints. And we're also going to do a caudal epidural. So it's a full treatment for the back that we normally do, especially for people that have disc diseases, degenerative arthritis in the spine, or any other type of lesion or injury to the low back. I try to do more of a holistic and a full treatment approach, if you will, because we're not only treating the disc issue, but we're also treating the ligaments that come with it and try to stabilize the back, because that's what's really going to help the patient with their recovery and is going to help with their getting back to their daily lifestyle. So
I think I'm about to have some blood drawn that will have the plasma and, if I'm not mistaken, the A2M.
Yeah, so we'll first do the blood draw, which will just get the whole blood, if you will, of the patient. And then we will actually administer a muscle relaxer to the patient so they're comfortable doing the procedure. And then we will process the blood, and that's where we'll do the extraction and we'll isolate those cells as well. 60.
Oh man.
So that's like the equivalent of like 12 tubes.
Okay.
Yeah. You're gonna push it slow. Just like once you see every like 10, 15 seconds. That's a muscle relaxer, just so that he's a little more comfortable for when we get to the procedure.
This is the life. I recommend everybody go through this right here. You have an open Wednesday afternoon, come down, see Dr.
Pretty
David.
good. Pretty close.
Have 120 cc's of blood withdrawn. 120. All right, so just had 120 cc's of blood withdrawn that they're gonna take to do the spinning magic that they do to prepare it for the actual injection in my lower back. So I had to fast at least 6 hours prior to the blood draw, and I did that because I think the last time we ate last night was around, what, 7 or 8?
All right, so we just finished, or we're finishing right now prepping the product that we extracted from the patient. So now we just finished with the second spin. So now we're going to extract the PRP component, and then we're going to start isolating or concentrating that A2M protein, which is found in the plasma. So normally we would actually discard the plasma, but this is a way that we can maximize the product that we extracted from the patient. And so that plasma we're going to extract or concentrate that A2M, which is going to provide anti-inflammatory properties. It's going to help with arthritis and halt the inflammation of the arthritis, and also help just healing in terms of the tissue around it as well. So we're excited to get started with the patient, and hopefully he will do very well. Is that head comfortable, lower, higher?
This is good for right
now. Okay. For right now. For later, you're definitely gonna. I mean, we can move it also, but we'll lower your pins a little bit here. Liner, eyeliner, because it stays on pretty good. Yeah, actually, yeah, because when we do the sterile clean, it'll just wipe it right out. All right, so we just got done with the procedure. Everything went excellent according to plan. There was no complications, no issues, which is excellent. The patient responded really well. He's on his way home already with the proper care. So he already has a brace that we actually fitted in the office for him. That's gonna help provide extra support. We're gonna do a follow-up in a week to make sure that there's no other issues arising in the next week or so. And then he's gonna start PT or physical therapy a week after today. So we're going to see how his progress goes and how that goes, and then we'll see him again in 6 weeks to again reassess his injury and to reevaluate his symptoms and see and make sure that everything is going well.
Hey, I just want to give a big shout out to AZ Modern Medicine and Dr. David Gallegos and the team. They were fantastic, treated me very well. The procedure was successful. You know, I didn't really think I was going to be able to get back out on the trail again, and thanks to everything he did for me, I'm able to get back at it, and I'm going to get stronger than ever. So thank you so much.